Hi everyone. So I'm happy and I'm super excited to be here after the NEET PG 2023, and I'm happy to share with you this is my 23rd or 24th year into this sector. We are the people who actually started NEET PG preparation formally in India. Before that it was all like first everybody was just randomly studying all this, and we started it in a structured manner. And the most important thing today is I'm very happy, very excited that all the suggestions that I gave you before the exams, I told you about the DVT, I told you about how to go about the PYQs, and I am very happy that all those things could make sense in the real exam. So after the exam, I did a quick survey and I asked many people that how many questions did you attempt? And the survey results were like this. Most people are on the top of the line. They attempted 180 plus, 190 plus. And whenever we see an exam like this where we see people have attempted 180 plus, 190 plus, that tells you that the paper was moderate, easy to moderate kind of difficulty level. So if you are there in the live chat, do tell me, है ना, do tell me if you how many did you all attempt, आपने कितने attempt किए मुझे बताएं, so that I can see if this data that I could do is right. And to the best of my understanding, to the best of my life as an educator, you should have been on 180 plus attempt ratio in this paper. This is the kind of the zone where you need to be at, because the paper was rich of PYQ topics. It was, totally answerable from the DVT. I can see, so I am so happy. And I'm also happy, and I'm also, super excited today, and it kind of validates my philosophy. My philosophy has been crisp, concise teaching from the day one since 1999, and I'm so happy that it stands tall today. People made thousands and thousands and thousands and thousands and thousands and thousands of hours of lectures, and they could not come close to the strike rate that we made with a small PYQ Cup BAP session. So I'm so excited today. And also I'm excited about the fact that the entire of the faculty team that we have could rally around in the DVT and create such a massive impact in the DVT also. So second poll that I did was I asked people how was the paper, was it easy, moderate, tough? Vast majority was towards the moderate difficulty level. I want all of you to let me know. I want all of you to let me know in the chat box, was it moderate or not, or what was your difficulty? Okay. And second thing I asked was which DAMS resources were more useful to most of the people were about class notes, DVT, PYQ Kebab. These were the most important resources for this year's paper. And I also asked people, what about the time required? Time required. Now this is interesting. Although people had attempted well, but majority of the people, they had just cut to cut time in the paper, cut to cut time. It was not like they had a lot of free time. It was not like के खत्म आसानी से हो नहीं हुआ या हो पर बीच का था, मतलब ऐसा just enough time था. Do you agree? So do you agree it was just enough time? It was not like ऐसा नहीं था कि आधा घंटा पहले पेपर खत्म हो गया, एक घंटा पहले खत्म हो गया, ऐसा नहीं था. So most of us, most of the children were able to do it about time to time. So that was the important thing. And once we see this, it tells us that there will be some questions in the paper which would be longer in their length. There would be some questions with visuals. तभी time लगा होगा, नहीं तो time कैसे लगता? Visual होते हैं, लंबा stem होता है तो लगता है. Okay? And so I also asked a lot of people how many questions they could do after the PYQ Kebab session, PYQ topics. So 20 to 40%, 40 to 60%, we can say approximately 50%, half of the paper you could have done if you were thorough with the PYQ topics. That was the analysis that we could get through the poll that we have done. Okay? And another interesting observation about the NEET PG 2023 is when I asked people what percentage of questions were long stem. Again, it is like 40 to 60%. Like if I take an average, half of the paper was longer stem questions. It was not simply one-liners, it was longer stem questions. And that is reflected in the time management part also, that people who found the paper longer, the questions longer, took more time also. So I hope this gives you the perspective, this gives you the idea that although, now if I summarize the paper, if you had done the DAMS DVT, if you've done the PYQ Kebab session, you would find that, okay, 50% of the topics are indirectly from that part. And this is the DAMS tradition that we have been able to predict in our revision series, more than 50% of the paper, and the tradition stands tall today as well. Second thing is that they are moving towards more analytical and comprehensive questions. So the number of long stem questions I feel is more than the previous years. This is more than what usually happens in NEET PG. Probably this is a indicator that they are going towards the next pattern in the subsequent year, or more analytical questions, more comprehension questions. So that is where the time management was the factor. So I am sure a lot of you would agree. Do you agree that if you were able to manage your time well in this paper, you would have done well? So time management is the important thing. So if you remember, I had given you advices like, do a DVT, do a grand test on the last day, get into the groove of giving grand test, बार टेस्ट दो, क्वेश्चन बैंक से खेलो मत, ग्रैंड टेस्ट दो, ग्रैंड टेस्ट दो, ग्रैंड टेस्ट दो, टाइम मैनेजमेंट करो, इज वेरी इंपॉर्टेंट. डू यू एग्री कि नहीं? ग्रैंड टेस्ट. So this is the thing that you have to agree. Then there were things like vitamin, and I am sure the examiner was high on something, alcohol, vitamin, ऐसा बहुत सारे क्वेश्चन थे, HIV and CMV, biochem, gyne, PSM, vitamins. I can see it on the chat also. So वो था ऐसा, HIV पे क्वेश्चन ज़्यादा थे, vitamins पे ज़्यादा थे, alcohol पे थे, they were late. And if you remember in my class I told you, if some of you had attended my class, I told you कि वर्निक्स पूछेंगे तो mammillary body आएगा तो पूछेंगे कि ophthalmoplegia, ataxia, confusional state, and all those things were there reflected in the real exam. Okay, and so this was the more or less the analysis and visual questions. Also I asked people, so to the best of my understanding, around 40 questions must be visual in the paper. Although there are people who believe it to be 40, so 40, 45 questions will be visual in this paper. So that is the, in a nutshell, the crux of the NEET PG 2023. More PYQ rich, usual topics, stand tall. It is the mantra that I want you to take home. Unusual, unnecessary material will pull down your rank. It is not going to make you win. This is going to be the mantra here onwards, that we need to make sure that we are thorough with the usual topics. And once you are clear, okay. So there was a question. I don't have the exact questions right now. I have not, created them so far. But what I have learned from the recall so far, there was this question on a young man with pain, back and stiffness, and they had an image similar to this, which could look like the bamboo and the dagger sign. Bamboo and the dagger sign. And this is directly a DAMS classroom image where you can see I am teaching this. This is ankylosing spondylitis. Ankylosing spondylitis. Okay. Now, this is a question where we have a confusion. So I want all of you to tell me in the chat box also. There was an image-based question where they had an image which was probably not this one. Some students are saying कि ऐसा image था, ऐसा शायद नहीं था. Do you agree कि नहीं? ऐसा था कि नहीं? कि बच्चा नहीं था वहाँ पे, वो adult था. मैं अभी दिखाऊंगा. So if you see the growth plate, the yellow mark thing is the growth plate. If the growth plate is open and you see a metaphyseal lesion, then it will be aneurysmal bone cyst. Probably this was not in the image. So all those children who are sending me this image in the class, this is DAMS classroom image. I have already said that this is probably not in the image. I think, just give me 1 second. Most likely the image was this. The same class, you can see my shirt also, same class image. I told you how to differentiate between GCT and ABC. GCT will be epiphyseal, mature skeleton, subarticular, expensile, so bubble. So it was giant cell tumor. And the age probably was 22-year-old, what I could gather from your chat box and I could gather from the students. So I'm sure, were you happy with the thing I told you in the class? I told you in the DVT, I told you in the PYQ, that GCT, ABC, simple bone cyst में confuse नहीं करना, ये आता ही आता है paper में. It is again a very important pattern. जब से, and when I say DAMS, it is like the history of NEET PG preparation in India. We started it in 1999. तब से ये GCT पूछते हैं, तब सिर्फ वर्ड्स में आता था, अभी इमेज आता है, यही फर्क है और कुछ भी नहीं है. So I hope you are agreeing to this. Okay, now let's go back. Another question that a lot of people have told me was something like this, a liver lesion with a crumpled membrane sign. They probably asked the management, which I'm sure your surgery faculty will be covering for you, but I hope you agreed to the radiology part that this was there in your classes where I told you, if you see a crumpled membrane in a cyst, think of hydrated. Because then if you see a membrane in a cyst, it has to be hydrated. Do you agree with me or not? है ना? तो hydrated के अंदर ऐसा crumpled membrane दिखता है. This is very important. Are you clear? Okay. Next was an image something like this. Okay. And a lot of people have, this is a hematoma overlying the brain. बट यहाँ पे ना हमारा सूचर होता है. दिस इज द प्लेस वेयर यू हैव अ सूचर. यू कैन सी द हेमरेज इज क्रॉसिंग द सूचर. And if you remember, this is the DAMS DVT, the gold standard NEETPG ka first aid. This is the DAMS DVT book where I showed you a similar image which was crossing the suture line. I told you if it is crossing the suture line, it is not going to be extradural, then it is subdural. ये subdural hematoma है. EDH suture को क्रॉस नहीं कर सकता, बाई कॉन्वेक्स शेप का होता है, और उन्होंने जानबूझ के ऐसा लिया तो थोड़ा सा ना कंफ्यूजिंग लग रहा है शेप से. बट इफ इट इज क्रॉसिंग द सूचर, कैनॉट बी EDH, हैज टू बी SDH. So this was the image in the DAMS DVT, and this was the image in the real exam from what I could recall from the students so far. And another thing I could recall from the students was कि sir एक question steeple sign पे था. So steeple sign is seen in the croup, and this is where, you know, I'm sure you remember we discussed this in the class. अगर trachea ऊपर जाके ऐसे subglottic ऐसे stenosis हो रहा होता है, that is steeple sign. Are you clear? Okay. Now this we have already discussed. And if you are a Damsonian, I'm sure you know how much I love silhouette sign. Silhouette sign is something which is very close to my heart. It is one of the most important founding principles of chest X-ray imaging. If you ever see a opacity in the lungs which is obscuring the cardiac border with air bronchogram, think of right middle lobe consolidation. Think of right middle lobe consolidation, and that is called as silhouette sign. Silhouette sign means if a mediastinal border is obscured by a pathology, that pathology should be in anatomical contact with the border. So if you see the cardiac border is obscured, go ahead and mark right middle lobe and come back. It is like the most important, the most classic chest X-ray sign that every radiologist loves, every pulmonologist loves, because of the name itself is so beautiful, silhouette sign. It is just like, you know, you are walking down and you see her and you can see the silhouette and you're like, wow, she's beautiful, like this. Silhouette means the borders, and this is the most important chest X-ray sign in radiology. Clear, everybody? And if you remember, in all my classes I told you, by TB to aayega, tuberculosis next mein bhi aayega, bhulna nahi hai. This was the CT image, asli exam mein X-ray tha. This is the classroom image where I taught you that there is one kidney calcified. Clear? Okay, and one kidney contracted. If you see in the real exam, it was an X-ray probably, and I'll you know, this is just a recall section. I'm just trying to, you know, verify. And sterile pyuria was written in the question, most likely I see in the chat. And so then you should think of tubercular kidney, and then they can go on to ask either they can go on to treatment or diagnosis. But the most important thing is that you should be able to identify. Okay. And this is one of the questions that is there directly in the DAMS image book, where, you know, the conceptual image book, this is me teaching. And I told you, if you see a disease which is causing ground glass appearance in the bone, with deformity, pathological fracture, Shepherd crook deformity, always think of fibrous dysplasia. सो एनोरिज्मल बोन सिस्ट एक्सपेंसाइल वाला होगा, तभी मैंने बोला वो मुझे लगता नहीं था पेपर में, मुझे लगता है ज्यादातर बच्चे एग्री करते हैं. डू यू एग्री दिस वाज द सिमिलर इमेज इन द पेपर? डू लेट मी नो. एंड इफ यू हैव फाइब्रस डिस्प्लेजिया, रिमेंबर आफ्टर दिस इन माय क्लास आई राइट कि इफ यू हैव मल्टी पॉलीऑस्टियोटिक फाइब्रस डिस्प्लेजिया विद प्रिकॉशियस प्यूबर्टी, थिंक ऑफ मैक्यूने अल्ब्राइट सिंड्रोम. आई थिंक दिस वाज द इमेज इन द पेपर. ओके, एवरीबडी क्लियर? ओके. And you know, so I hope you can all agree to the fact that, you know, this is almost what I could gather in the recall, and it was 100% strike rate this year. Now I want to ask you, अभी क्या करेंगे एग्जाम के बाद? पार्टी करेंगे? पार्टी ही करेंगे? सोएंगे? अपनी गर्लफ्रेंड बॉयफ्रेंड से मिलने जाएंगे? इंस्टाग्राम की रील देख देख के टाइम काटेंगे, या कुछ भी नहीं करेंगे? क्या सोचते हैं? So do let me know in the chat box, अभी क्या करेंगे? I did a survey and majority of the people said sleep. बहुत सारे लोग सोना चाहते हैं, क्योंकि थक गए. आई कैन टोटली एग्री. नाउ ऑन अ मोर सीरियस नोट, आफ्टर द एग्जाम आई वुड वांट यू टू डू ओनली 3 थिंग्स. नंबर 1 इज टू स्पेंड सम टाइम विद योर पेरेंट्स, बिकॉज आई फील कि उन्होंने जितना आपने मेहनत किया है उतना उन्होंने भी आपके साथ किया है. दे हैव गॉट यू सो फार. So spend time with your parents. Okay, let me know in the chat box how many of you are going to spend time with your parents today. At least आधा घंटा लगाएंगे, चाहे अगर वो दूर हैं तो फोन पे लगाएंगे, बहाना नहीं मारेंगे कि अभी घर पे नहीं हूँ. आधा घंटा कम से कम पेरेंट्स के साथ बिताएंगे, बात करेंगे. गर्लफ्रेंड बॉयफ्रेंड ये रिश्ते बाद में बनेंगे, लेकिन पेरेंट्स तो पहले से है ना, उनसे एक बार बात कर लेंगे. आधा घंटा. यू एग्री? Okay, spend time with them because they are as anxious as you are right now. उनको भी उतना एंजाइटी जितना आपको, प्रॉब्ली ज़्यादा होगा. अपने बच्चे के एग्जाम में ज़्यादा टेंशन होती है. मेरा बच्चा क्लास 6th में है एंड डॉक्टर दीप्ति इज टीचिंग हिम फ्रॉम मॉर्निंग टिल आफ्टरनून टिल इवनिंग. इतना एंजाइटी तो आई कैन आई होप यू कैन अंडरस्टैंड व्हाट वुड बी गोइंग थ्रू योर माइंड्स ऑफ योर पेरेंट्स. स्पेंड टाइम विद योर पेरेंट्स. ओके, number two is, don't overanalyze what you've done in the paper. Just see the recall videos, get a hang of it, then relax and just leave it to the bigger plan. In every one of my videos, I have always talked about that there is somebody who's sitting above us, who is making a plan for all of us, who हम सबका ध्यान रख रहा है. So, have faith in the bigger plan. जो होगा अच्छा होगा. Okay, type it in the chat box also. Come what may, जो होगा अच्छा होगा. And I'm so happy that many of you, probably or hundreds of you, have sent me a message on Instagram saying that you have come back with no regrets. And that is what I told you to in the last video, कि no regrets. वापस आएंगे बिना regrets के साथ. So I'm so happy that you have no regrets. So please let me know in the chat box कि अपना best किया, no regrets. Yes, no regret. That is most important. Result जो आएगा वो देखेंगे यार. लेकिन आपको regret नहीं होना चाहिए कि आपने अपना best नहीं किया. So do you have no regrets? Yes. And the third thing, and the final thing I wanted to tell you today is very important is, after you take a day off, you sleep, you scroll Instagram, ये सब जब कर लोगे ना तो थोड़े दिन बाद फिर से खाली लगेगा. मेरी ज़िंदगी में हमेशा ऐसा हुआ है, जब भी मैं कुछ कर लेता हूँ मुझे लगता है यार एक बार ये हो जाए इसके बाद कुछ नहीं करना. Whenever I reach there, you start feeling empty again and you start wanting to have another challenge at hand. It is a good idea, if I was in your place, it is a good idea to have a 1 or 2 days off and then also start preparing for INICET, because by the time NEETPG result will come, in the May first week they will be doing INICET exam. It's a good idea to start preparing for INICET also side by side, so that little bit. Don't go into unusual, focus on the usual things. I also want to announce here, in April we will again do a session which will be for INICET. It is going to be called as INICET capsule. It will be on eMedicoz app live, just like we did the PYQ ka session. We will take care of your previous year questions of INICET. We will discuss the usual topics in that session. So that will be scheduled in April. It is a good idea to target that exam as well. And it is a good idea to, to just spend today as a moment. I'm a little bit overwhelmed by the messages that the students have given. I'm excited, I'm happy, and I want to tell you that this is the feeling I have been getting since last 23 years. After every exam, I'm so happy when the students come back and say कि sir जो आपने पढ़ाया वो पेपर में आया. I'm grateful that we could be a meaningful part of your journey so far. I wish you all the best. Keep rocking. And याद करना है जो हमने एग्जाम से पहले बताया था, आग लगा देनी है. आई विश यू ऑल द बेस्ट. आई एम सो हैप्पी दैट आपने आग लगा दी है. थैंक यू वेरी मच. गॉड ब्लेस यू.